I want you to pause for just a moment before we begin. I want you to think about this morning. Think about the first thing you did when you opened your eyes. Did you reach for your phone? Did you sit up quickly? Did you head straight to the kitchen without drinking a single drop of water? Did you pour yourself a strong cup of coffee before eating anything at all? Most people do not think twice about those first few minutes of the day. They feel normal. They feel harmless. They feel like just waking up. But here is what most people do not realize. For men and women over the age of 60, those first few minutes of the morning may actually be the most vulnerable window of the entire day. And one very common habit, something millions of seniors do every single morning without thinking, may quietly be increasing the risk of stroke in ways that many doctors are beginning to take very seriously. This is not meant to frighten you. I want to be very clear about that. I am not here to cause panic. I am a doctor, and I speak to patients every week. Older patients, patients just like you. And I feel a quiet responsibility to share what I have observed over many years of practice. Not everything that needs to be said gets said loudly enough. So today, I want to speak to you slowly, carefully, the way I would speak to a patient sitting across from me in a quiet room. Because what I am about to share with you may be one of the most important things you hear this year. Let me start with something that surprises many of my patients when I first bring it up. Most people believe that stroke is something that happens suddenly, out of nowhere, without warning. And sometimes, yes, it can feel that way. But what many doctors have observed over the years is that stroke rarely appears from nothing. In most cases, the body has been quietly building toward that moment for a long time. And in many seniors, that process, that slow, quiet buildup, is being unknowingly accelerated by habits that seem completely normal. Habits that feel healthy. Habits that nobody ever told them to question. This is where it gets important. And this is also the part that surprises most people. It may not be your heart that is the primary concern in those first moments of the morning. It may not be your diet the night before. The real issue, the one that many people overlook, often comes down to what is happening inside your blood in the hours between midnight and the time you finally get up and move. Let me explain what I mean. When you sleep, your body does something remarkable. It slows down. Your heart rate drops. Your breathing becomes shallow and steady. Your blood pressure changes. And your blood itself, the fluid that carries oxygen and nutrients through every vessel in your body, becomes slightly thicker, more concentrated. This is a natural process, and in younger, healthier bodies, it corrects itself quickly after waking. But in the body of someone over 60, this process does not always correct itself as fast. And if certain morning habits are layered on top of that already thickened blood, the risk of something going wrong in the brain may increase in ways that are quiet but meaningful. Some studies suggest that the hours between early morning and mid-morning, roughly from the time a person wakes up until about 2 hours after, represent a period of elevated cardiovascular stress. The body is transitioning. Blood pressure is rising. Cortisol, the body's stress hormone, is climbing. The heart is working harder. And the blood is not yet fully rehydrated. For a person in their 30s or 40s, this transition is managed without much difficulty. The body compensates. The vessels are flexible. The blood flows freely. But after 60, and especially after 65, the vessels may be less elastic, the blood may be slower to thin, the heart may be working against more resistance. And in that exact window of time, that fragile morning transition, certain habits may tip the balance in the wrong direction. I have seen this pattern many times in my years of practice. I want to tell you about a patient I spoke with not long ago. She was 68 years old, a kind woman, sharp mind, active in her community. She walked every afternoon and took her medications faithfully. By most measures, she was doing things right. But when I asked her about her morning routine, just casually the way I sometimes do, she described something I have heard hundreds of times. She said that every morning before she did anything else, she made coffee. Strong coffee. She had done it for decades. Then she sat down at the kitchen table, turned on the news, and spent about 40 minutes watching the headlines before she ever took a sip of water, before she ever ate anything, before she ever stood up and moved her body. She did not think anything of it. Why would she? She had done it her whole adult life. It felt like comfort. It felt like routine. It felt like just being herself in the morning. But here is what we talked about that day. Caffeine, especially on an empty stomach, in the absence of water, in a body that has just spent 7 or 8 hours without fluid intake, may have effects on blood pressure and blood vessel behavior that are worth taking seriously after a certain age. Some research suggests that caffeine consumed in this way, concentrated early, without food or hydration, may cause a sharper spike in blood pressure than it would in a younger person or in someone who had already rehydrated. And that blood pressure spike, however brief, occurring in blood that is already at its thickest point of the day, is something many doctors quietly note with concern. I want to be clear. I am not telling you that coffee will give you a stroke. That is not what I am saying. Coffee has been part of human life for centuries, and many studies suggest it can have benefits. But the timing, the amount, the context, these things matter more than most people realize. And for someone over 60, paying attention to those details may make a meaningful difference. She made one small change. Instead of reaching for the coffee maker the moment she woke up, she started drinking 1 full glass of water first. Just water, room temperature, before anything else. It took her about 30 seconds. Then she waited 10 minutes before starting the coffee. That is all. 1 glass of water, 30 seconds, every morning. She told me at her next appointment that she felt different, less foggy in the mornings, less of that strange pressure behind her eyes that she had always assumed was just aging. It may not seem like much, but in the body of a person over 60, small adjustments in the morning can have effects that ripple through the entire day. Now, I want to walk you through several other morning habits that many doctors have quietly observed as potentially concerning for seniors. Some of these will surprise you. Some may feel very familiar. All of them are worth considering, not with fear, but with awareness. The first one is something almost everyone does. You wake up, and within seconds, sometimes before your feet even touch the floor, you reach for your phone. You check the time. You check your messages. Maybe you scroll through the news. Maybe you see something upsetting, a headline, a comment, a piece of information that sends a small wave of stress through your body before you have even taken your first breath of fresh air. It may seem harmless. It is just looking at a phone, right? But here is what is often overlooked. In those first few minutes of waking, your nervous system is in a very specific state. It is transitioning from sleep to wakefulness. Your brain is deciding, based on the very first signals it receives, whether the world you are waking up into is calm or threatening. And when the first signal it receives is alarming news, or a stressful message, or even just the visual noise of a busy social feed, the body may respond with a stress response that raises cortisol, tightens blood vessels, and increases blood pressure. In a younger body, this is manageable. In a body over 60, where the vessels are already less flexible and the blood is already at its thickest, this early morning stress activation is something worth taking seriously. Many doctors have observed that patients who report high morning stress that begins before they even get out of bed, also tend to report more cardiovascular symptoms throughout the day. Whether this is a direct connection or simply a reflection of overall habits, the pattern appears frequently enough to notice. The simple adjustment? Try waiting. Just 10 minutes. 10 minutes before you look at your phone. Use those 10 minutes to breathe slowly, to sit quietly, to drink your glass of water, to let your body transition into wakefulness gently, on its own terms, without the immediate intrusion of the outside world. 10 minutes, that is all I am asking. The second habit is one that many seniors are surprised to hear about, because it is something they were told to do for health reasons. Many people over 60 take medications in the morning: blood pressure medications, blood thinners, cholesterol medications, heart medications. And many of them, because they were told that consistency matters, take those medications the moment they wake up, sometimes with only a small sip of water, or sometimes with no water at all. This is where many seniors make a mistake. Medications taken without adequate water, especially in a body that is already mildly dehydrated from sleep, may not absorb or behave the way they are intended to. Some blood pressure medications, in particular, may have effects that interact unpredictably with the body's own morning blood pressure changes. And certain medications can cause dizziness or drops in blood pressure when a person stands up quickly, a phenomenon called orthostatic hypotension, which is itself a known risk factor for falls and cardiovascular stress in older adults. I'm not telling you to change how or when you take your medications. Please do not do that without speaking to your doctor first. What I am suggesting is that if you are not already drinking a full glass of water before and after your morning medications, this may be worth discussing at your next appointment. This is the part that surprises most people. The medication is meant to protect you, but the conditions in which you take it may affect how well it works. And in the body of a person over 65, those conditions matter more than they did 20 years ago. The third habit is one of the quietest dangers I want to mention today. It is something many seniors have been taught to believe is healthy. In fact, it is something that is genuinely healthy in the right context. But in the morning, in the wrong order, it may be adding unexpected stress to the cardiovascular system. I am talking about vigorous morning exercise performed immediately after waking. Now, I want to be very careful here. Exercise is essential. I encourage all of my patients to move their bodies regularly, and physical activity after 60 is one of the most powerful protective factors against a wide range of serious conditions, including stroke. I am not questioning the value of exercise. But here is what is often missed. When a person wakes up, their blood is thick. Their blood pressure is already rising naturally as part of the morning cortisol surge, and their cardiovascular system is still in the process of shifting from sleep mode to daytime mode. If that person then immediately performs vigorous exercise, intense walking, lifting, fast cycling, anything that sharply elevates heart rate, They are adding significant cardiovascular demand on top of a system that is not yet fully prepared. Some studies suggest that the rate of cardiac events and strokes during exercise is higher in the early morning than at any other time of day. This does not mean morning exercise is dangerous. For most people, it is fine. But for someone over 60, who may already have some narrowing of vessels, some stiffness in arterial walls, some elevation in baseline blood pressure, the combination of early morning conditions and vigorous activity may occasionally push the system into territory worth being cautious about. The small adjustment? Spend 10 to 15 minutes warming up gently before any vigorous movement in the morning. Walk slowly around the kitchen. Stretch in your chair. Breathe deliberately. Give your cardiovascular system time to wake up before you ask it to perform. It sounds simple, and it is. But I have spoken with many patients who have noticed a real difference. Less dizziness, less chest tightness, less of that unpleasant pounding sensation in the head, simply by softening the transition into morning movement. The fourth habit is one that almost nobody talks about, and I think that is exactly why it is so important to bring up here. It is about the position in which you wake up and stand up. Many people over 60 get out of bed the same way they have their whole lives. They open their eyes, they sit up, and they stand up, quickly, without thinking. They may be heading to the bathroom, they may be responding to an alarm, they may simply be in a hurry. But the body, after 60, does not always respond well to sudden positional change. When you go from lying flat to standing upright in a matter of seconds, blood pressure must adjust very quickly. In a younger body, this adjustment happens almost instantly. But in an older body, one where the blood vessels may be less responsive, where circulation may already be slightly sluggish, this rapid positional shift can cause a temporary but significant drop in blood pressure, particularly the blood flow reaching the brain. This is called orthostatic hypotension, and some studies suggest it affects a meaningful percentage of adults over the age of 65. Many people experience it as a brief dizziness or a moment of visual blackout when they stand up. Some dismiss it as nothing. Others have learned to simply pause and wait for it to pass. But here is what many people do not realize. In a body where the blood vessels are already under stress, from dehydration, from caffeine, from early morning thickness of the blood, this brief drop in cerebral blood flow may, in some cases, represent a period of genuine vulnerability. I have spoken with patients who experience their first stroke symptoms. A sudden moment of confusion, a brief loss of vision in one eye, a strange weakness on one side of the body. In the seconds immediately after standing up from bed, not always, not commonly, but the pattern appears enough that it is worth knowing about. The adjustment is simple and takes almost no time. Before you stand up from bed, sit on the edge for 30 seconds. Just 30 seconds. Let your legs dangle. Let your blood pressure stabilize. Take 2 or 3 slow, deliberate breaths. Then stand up slowly, using something for support if needed. That short pause gives your cardiovascular system the time it needs to prepare. 30 seconds every morning. That is a habit that could matter more than you might imagine. Before I continue, I want to pause and acknowledge something. If you are listening to this and feeling some concern, I want to reassure you. The habits I have described are not sentences. They are not verdicts. They are patterns that many doctors have quietly observed, and they are patterns that can be gently adjusted. Small changes, made consistently over time, can shift the conditions in your body in meaningful ways. That is not wishful thinking. That is how the body works. You are not too old to change these patterns, and you are not too old to benefit from changing them. But I do want to be honest with you about what may happen if these patterns continue unchanged. Not to frighten you, but because I believe you deserve that honesty. Here is what many doctors quietly worry about when they see these habits going unchecked in their older patients. The body, after 60, has less reserve, less tolerance for repeated stress. What a 40-year-old body can absorb and recover from in a morning, a 65 or 70-year-old body may handle less efficiently. Over time, over months and years of the same patterns, small stresses accumulate. Vessels that are repeatedly pushed in the early morning may gradually become less flexible. Blood pressure that is repeatedly spiked before it has a chance to stabilize may gradually become harder to control. And the brain, which is the most sensitive organ in the body to disruptions in blood flow, may begin to show signs of that accumulated stress in ways that only reveal themselves later. Cognitive changes, memory lapses, that strange fatigue that you cannot quite explain, the lightheadedness that seems to come more often. Small things that get dismissed as normal aging when they may actually be signals worth paying attention to. I have heard from patients who looked back after a serious cardiovascular event and recognized the warning signs they had been receiving for months. Little things, easy things to dismiss. A brief moment of confusion that passed quickly. A few seconds of blurred vision in one eye. A sudden, strange weakness in one hand that lasted only a minute. These are called transient ischemic attacks by medical professionals, and they are often described as mini strokes. They are the body's way of saying that something upstream is not right, and they frequently occur in the morning, in the vulnerable window I described earlier. If any of these experiences sound familiar, please do not dismiss them, and please do not wait. Speak to your doctor as soon as possible. These signals are important. Now I want to offer you something different. I want to offer you the other path, because there is another path, and it is not complicated. It does not require dramatic changes or expensive interventions or giving up everything you enjoy. It requires awareness, and it requires a few small, consistent adjustments to what you are already doing every morning. Imagine waking up tomorrow and doing things just slightly differently. Before your feet touch the floor, you sit on the edge of the bed for 30 seconds. You breathe slowly. You feel the weight of your body settling, the blood pressure finding its balance. Then you stand up carefully, one hand on the nightstand. You walk to the kitchen. Before anything else, before the coffee, before the phone, before the news, you pour yourself a full glass of water. Cool or room temperature. You drink it slowly, over about a minute. You feel your body beginning to rehydrate, the blood beginning to thin, the vessels beginning to soften. You wait 10 minutes before your first cup of coffee. You sit in a chair, near a window if possible, in quiet. No phone, no headlines. Just a few minutes of calm transition. You let your nervous system decide on its own that the morning is safe, that there is no emergency, that the body can move from sleep to wakefulness gently. Then, when you are ready to exercise, you begin slowly. 5 minutes of gentle movement before anything vigorous. A few stretches in your chair. A slow walk from room to room. You give your cardiovascular system permission to prepare. And at your next doctor's appointment, you mention the things you have been experiencing in the mornings. The dizziness, the pressure, the occasional moments that felt strange. You give your doctor the information they need to help you. This is the other path. And in the body of a person over 60, this path may make a difference that is not immediately visible, but that accumulates quietly over months and years in the form of protection, in the form of mornings that feel better, in the form of a brain that continues to receive the blood and oxygen it needs to do its remarkable work. I want to speak to you now about something that I think often goes unsaid in conversations about senior health: independence. For most of my older patients, when I ask what they fear most, it is not death. It is loss of independence. It is the idea of not being able to drive themselves to the store, not being able to walk to the garden, not being able to remember the names of people they love, not being able to live in their own home on their own terms. Stroke is one of the leading causes of long-term disability in adults over 60 in the United States. And while not every stroke leads to permanent disability, many do. And many of those strokes could have been, at least partly, influenced by patterns of daily habit that went unexamined for years. I am not saying you can prevent every stroke by changing your morning routine. That would be dishonest, and I will not say it. Stroke is complex. Genetics matter. Existing conditions matter. Medications and medical history matter. There are things outside your control. But the things that are inside your control, the daily habits, the morning routines, the small choices made in the first hour of each day, these are not nothing. These are meaningful. And in a body over 60, they may be more meaningful than at any other time in your life. You have earned the right to the next chapter of your life, to the mornings with your family, to the walks you enjoy, to the independence you have worked so hard to maintain. These small changes are not sacrifices. They are investments. And they are investments that may pay returns for years to come. Before I close, I want to offer you one more thought. Many of my patients, when I share information like this, feel a mixture of things. Some feel concerned. Some feel a little frustrated that nobody told them this sooner. Some feel relieved to finally have a name for things they have been experiencing. All of those feelings are valid. But I want to encourage you to move forward not from fear, but from knowledge. There is a meaningful difference between those two things. Fear makes people feel powerless. Knowledge makes people feel capable. And you are capable. You are more capable of protecting your own health than the medical system sometimes gives you credit for. 1 glass of water. 30 seconds on the edge of the bed. 10 minutes away from the phone. A gentle warm-up before vigorous movement. These are not burdens. These are gifts you give yourself every morning. And if you are experiencing symptoms that concern you, if you have had moments of sudden confusion, sudden weakness, sudden changes in vision or speech, even briefly, please speak to a doctor promptly. Do not wait for the next scheduled appointment. These are symptoms that deserve immediate attention. I want to close by saying what I always say to my patients at the end of a difficult conversation. You are paying attention. That matters. The fact that you are here, listening, learning, thinking about your health, that already puts you ahead of so many people who are not asking these questions. Thank you for spending this time with me today. Take it slowly, one morning at a time.